They have put this forth to make it look like, oh, we've improved the bill. No, it doesn't improve the bill.
What this amendment would do is provide additional funds directly into the high-risk pools.
As if it's enough to provide support for pre-existing conditions.
I'm anxious to vote yes. I'm anxious to see what the Senate will do with our product.
Trump care cannot pass the Senate. So to my moderate Republican colleagues in the House, I ask, why would you risk a yes vote?
We just need to take the vote and do it, and I think it passes as soon as we do.
We've been gaining votes today, and that's been a real positive development.
Meetings are continuing at this hour up on Capitol Hill. We cannot say yet whether they're going to try to vote on repeal and replacing Obamacare, this health care bill, tomorrow in the House. We can say a lot of meetings happened today. For example, the Vice President was up on Capitol Hill, as was the HHS Secretary, the CMS Administrator. And there was some optimism. As you look at the Dow, I mentioned it with Liz Clayman, about 11 noon, there was word that 2 key health care votes had come over, and there was indication that the Dow liked that news. Maybe it was the spending bill as well. But they're moving. Let's see how much. Let's bring in our panel. Molly Hemingway, senior editor at The Federalist. Jonah Goldberg, senior editor at National Review. And Carol Lee, White House correspondent for The Wall Street Journal. Carol, your sense, I mean, after that meeting at the White House, is there a sense at the White House that this is kind of going to come to fruition?
They feel much better about it. I was at the White House today when the House members came out and talked to reporters after the meeting with Trump. It was a lengthy meeting, and they seem to have reached some sort of compromise that they feel they can thread the needle with this. And the White House later, however, made some pretty significant promises, saying that the preconditions would be the same exact, the guarantee that everybody who had used the preconditions provision would have the same effect and it wouldn't change. They also admitted that they don't know exactly what the effect would be on premiums, and so they're optimistic about this. And as you know, they've had a very tough go so far on any of the president's legislative priorities, so they would very much like a vote on this. And then it goes to the Senate, where obviously that's a much tougher haul. You're talking about the pre-existing conditions, and this was a big problem for moderates particularly. The president also referenced it this weekend. Fred Upton from Michigan offered an amendment, and basically here he is explaining what it does.
It's our understanding that the $8 billion over the 5 years will more than cover those that might be impacted, and as a consequence keeps our pledge for those that in fact would be otherwise denied because of pre-existing illnesses. So the guess is that should a state decide to go for a waiver, that there'll be fewer at the beginning than the end of the 5 years.
So to keep it simple, Jonah, this bill puts people into high-risk pools, and that's their solution for pre-existing conditions. If for some reason they slip through the cracks, this amendment provides money to make sure that they are covered.
Yeah, and frankly, I find the whole thing kind of bizarre. First of all, Fred Upton has been talking for years now about doing precisely what he spent the last week opposing. And it's a very bizarre, hypocritical position that he's taken. But moreover, the GOP, particularly the GOP moderates, seem to have bought into the spin that was put out in very aggressive style by the Obama administration, that the key issue here is pre-existing conditions, that is what kept people from getting insurance, when that was actually a tiny fraction of the issue. The real issue isn't pre-existing medical conditions, it's pre-existing economic conditions. But pre-existing medical conditions polls better. It's one of the only really popular features of Obamacare. And the Republicans seem to have bought into it, even though, like Tom MacArthur from New Jersey, a lot of these states, like New Jersey, already have guarantees about pre-existing conditions and had them for decades. So even if they got a waiver from Obamacare, it wouldn't affect anybody with pre-existing conditions. It's a weird poll testing a complaint of convenience rather than dealing with the actual issues about getting more people insured.
And here is Raul Labrador on this very issue, making that argument.
You guys in the media have been reporting that we're not taking care of people with pre-existing conditions, and that's just absolutely false. What our bill does, it creates what's called an invisible risk pool, where everybody's premiums are going to be going down, and some people's premiums are going to be subsidized by the government, and those people are going to be usually people with pre-existing conditions and others.
All right, Molly.
Well, the question of polling is also interesting because people actually don't support having these big provisions for pre-existing conditions when they understand how expensive it is and how little it actually has to do with health outcomes. There's also something just utterly bizarre about not understanding economics 101 of insurance, where you need to be paying into it for a long time, not having free riders who only come in and pay up once they need medical care, and then also that there's not an understanding that people who cost more in terms of what their insurance costs are should be sharing a bigger share of the burden. That doesn't mean that they have to pay all of their burden or that it should bankrupt them or anything like this, but this is just a basic schematic of insurance, is that you want to make sure that people are incentivized properly. So this is an interesting change.
Yeah, Democrats are howling. Senator Schumer on the floor talking about this amendment.
We don't even know if the new version would survive the rules under reconciliation. The amendment to allow states to drop pre-existing condition requirement, for instance, very possibly violates the Byrd Rule. If the moderate group in the House gets an additional amendment to deal with the very same issue, that may violate the Byrd Rule as well.
And before everybody at home glazes over, the Byrd Rule, just to be clear, this is from the Washington Post. In the 80s, Senator Robert Byrd, a Democrat of West Virginia, advocated for a rule to prevent anything that doesn't directly change the level of spending or revenue, or where the changes are mere incidental to the policy, from being passed under reconciliation. It's known as the Byrd Rule, and any senator can raise a point of order under it to challenge a policy's pertinence to the budget. The Byrd Rule is largely what keeps policymakers from just passing an entire Obamacare repeal replace bill under reconciliation and calling it a day. Reconciliation, Carol, enables the Republicans to vote it through with 51 votes and not 60.
Right, and that's what you described there is one of the many challenges that this legislation is going to have when it moves to the Senate. Republicans can only afford to lose 2 senators in whatever process takes place in the Senate, however they change that bill, so that's going to be a challenge. And then obviously it has to go back to the House, and they have to reconcile that there. So we're in the beginning of a very long process, and I think what's happened is that the White House has so much wanted just some sort of movement on their legislative agenda that they've put a lot of stock in this one House vote, but it's really just the beginning.
Any other day, Jonah, the leader of the Palestinian Authority meeting with the president in the Oval Office would have been the top, but this is drinking from a fire hose.
Yeah, and it's been like this, it feels like now for, what, 103 days. It's a newsy environment. It's remarkable. Is
the Middle East peace talk that the president said, you know, he said, well, they might not have been as tough as it has been. I believe that we can get this done. And he says, let's prove them wrong. And Abbas says, okay.
It's delightful to see this level of optimism about fixing something that goes back for so long. But it's good that people are beginning to make some movement, and we'll see how things go.
He really raised expectations today in terms of his ability to get a deal.